Well, hello everyone. I'm really excited. This is Dr. Joe Pecoraro. I am a board certified general surgeon with vascular surgery fellowship in Florida, and I'm just talking tonight with Dr. Alinda Cox, who's not only a good friend and missionary colleague, but in addition to that, she's a gynecologist in the Austin area. And tonight we're going to discuss something that a lot of people don't think about when they think about cancer risk. So if you come on live with us, if you would just put that in the chat where you're coming from. And by the way, feel free to share this on your timeline because it's important information and I think valuable information that a lot of people could use. Well, Alinda, I'm going to start out and just say that, first of all, I'm so glad to have you on here. I know you're busy, you're just getting over the flu, and yet this is such an important issue.
Absolutely.
Because when we look at the rate of cancers, we know that in under 50-year-olds, the rate of cancer is increasing in a number of different cancers, and primarily 6 of those cancers, it's really alarming to healthcare physicians, and that's cancer of the kidney, cancer of the pancreas, cancer of the gallbladder, cancer of the colon and rectum, multiple myeloma, and what we're going to be discussing tonight, which is endometrial cancer. And what I'd like to have you do, if you would, is maybe just discuss a little bit about what endometrial cancer is and some of the other risk factors and symptoms, and we're going to talk about more specifically later on how obesity is related to that.
Yes, absolutely. Well, as you said, Joe, endometrial cancer is increasing in those women that are less than 50. It really was a major problem in women that were postmenopausal or after the age where they had stopped menstruating. But now we see, because of a number of factors, particularly obesity, that endometrial cancer is increasing in this age group that are less than 50. As a matter of fact, I had a patient who was in her late 20s who was diagnosed with endometrial cancer, and she was morbidly obese. And so endometrial cancer is a abnormality, a cancerous transformation of the cells inside the lining of the uterus. This is that uterine lining that has to do with menstruation. It's that lining that supports a fetus. Should a woman be pregnant? So it's inside that cavity that these endometrial cells become abnormal. One of the biggest risks of this is extra estrogen in a woman's body that tends to make these cells become abnormal. And so what we know from obesity, or in women that are obese, that other hormones, mainly androgens or androgen type hormones, are transferred or turned into estrogens. And these estrogens then stimulate the endometrial lining and increase the proliferation of those cells inside that lining, and ultimately, in some cases, cause endometrial cancer.
So, Alinda, if without getting like real graphic, I just want to review a little bit of the anatomy, because we know that there's sometimes, especially people who haven't studied anatomy and physiology like you and I have, ovaries, endometrium, uterus. So to clarify, the ovaries are connected by tubes to the uterus, and the uterus, the endometrium is actually the lining of the uterus, or what
Exactly.
would commonly be called the womb. That's why when you say that it supports the fetus, that's the area that when
Yes.
when an egg is fertilized, that's the area that it embeds in and starts to grow.
Yes. Exactly. Exactly.
And now we know that although obesity is a risk factor, obesity is a risk factor for a number of cancers, by the way, and we don't always know exactly how it's related. So in other words, we can't say being overweight caused your cancer. But what we
Absolutely.
can say when we say risk factor is we know that women who are overweight and obese have a higher risk of developing those cancers.
Absolutely. I was actually just in preparation for this live interview, was just researching some of the more recent studies, and it found that women that have a body mass index, or it's commonly called BMI, which is a measure of how much fat is on on a person's body, the body mass index, as it increases, means that that person is more in an obese or overweight state. Well, if a woman's BMI is between 25 and 29, her endometrial cancer risk is doubled over that woman who has a normal weight. If a woman's BMI is over 30, that risk triples against their female counterpart that has a normal body weight.
So what I'm hearing is that it's not just being obese, it's being overweight or obese. So I wonder, is there, and I don't know if you happen to come across this, is there a direct correlation with, as the weight increases, then does the risk increases? For instance, there's morbidly obese, there's super obese. Does that, do those people have an even greater risk, or do you know?
Well, it seems from the study that the higher the BMI, as I said, from 25 to 29, there's a doubling of the risk. And then over 30, the risk triples. So we would deduce then that as you continue to go higher and higher in your BMI, that risk would also increase as well.
Wow, that's pretty wild, because I know when people think about cancer, especially the millennials, they're thinking about smoking, they're thinking about uh, environmental toxins and all kinds of things like that. They're not thinking too much pizza or too many wings or
Yes.
this kind of thing.
Yes.
And I know at another time we're probably going to talk about the relationship with some of the other women's cancers related to obesity, but it's a real risk. And what I know is that in the lowest age group that we were talking about, like the 20 to 34, the rates are
Yes.
increasing at an even greater rate than the other ages, and we don't know why. And this is kind
Exactly.
of, this is alarming, because you and I know that if a person finds the right program like you and I did, and this is probably a good time to segue into the fact that for those of you who don't know, I lost 123 pounds almost 15 years ago
Yes.
now. And Dr. Cox lost
Yes.
20 pounds or so this past year. And so most
Yes.
people want to lose weight because they want to feel good. They want to maybe get off some medications, this, that, or the other thing. But if
Yeah.
they knew, wow, my cancer risk is going to go down, that might even be an additional motivator.
Absolutely. Absolutely.
Now you're getting ready probably to start having office hours again this time of year, Alinda.
Yes.
Are you? Do you notice? Because I know that I did when I was still practicing in an office, that this time of year people would come in and they'd say, they would either like fish for help. In other words, they'd say something along the lines of, "Oh, I really need to get some of this weight off,"
Yes.
or they might actually come right out and say, wow, this is one of my resolutions to
Yes.
get some weight off or to get healthier this year. Do you see that in the
Oh, absolutely.
GYN world as well?
Absolutely. The first of the year is just the prime time when people, you know, they get that motivation. They're done with the holidays, and they're ready to get started. And I think what I have found is that many people are looking for a plan. Many people need a structured plan in order to be successful, and they need encouragement. And so I see that all the time in the office, where someone has decided, yes, I've got to do better with my weight.
And I know there's studies that show that one of the reasons why people start diets on a Monday, or they start their exercise program on a Monday, that there's some real validity to that, because it's kind of like a beginning point. And here we are, the beginning of a month, the beginning
Yes,
of a year, the beginning
yes,
of a decade. And what
yes,
I would like to do is I really like for people to reflect, because what I like to do is reflect on the past and use that to learn from it,
yes,
and then move forward with the knowledge that I learned. So for instance,
absolutely.
um, if I 10 years ago said, I want to lose weight, I want to get healthy, and I still haven't done it, then maybe it's time to change the routine a little bit. Maybe it's time to look for something like you and I found.
Exactly, exactly.
Because you mentioned a structured program, and that was one of the beautiful things that I found. Is I know these days, one of the reasons people eat so much junk food is because they feel like they don't have time. And
Yes,
that was me. Busy vascular and general surgeon, solo practice, 2 adolescent kids, busy at the church, running the mission organization. And
yes,
my friend showed me this program, and I was like, oh yeah, well, I barely have time to breathe.
yes,
And yet what I found was, by having structure, by
yes,
having portion controlled fuelings that have all the nutrition, balanced protein, low
yes,
glycemic carbohydrate, vitamin, not a fad that eliminates any specific macronutrient, but incorporates everything and still gives us a behavioral plan
yes,
with an app that gives us reminders,
yes.
and at the same time to be able to have accountability from a coach and online support group. I mean, we didn't
Yeah,
have all that when I got on. You did have that.
I
And
did have that, and it was really very important, just for all those very reasons that you talk about, because we don't have time. Who has time really in this day and age to sit down and put food on a scale and figure out how many ounces of this and how much protein am I getting in that? And so the program makes it very, very easy. All you have to do is eat every 2 to 3 hours with the fuelings, and you will get down to that goal weight that you want.
and the beauty is you have someone to share the success with. I know the community, to me, although initially I didn't think we really needed it, or it was, what is this all about? What I found is it's really fun. I mean, it's nice to be able to be around like-minded people and have people encourage you,
Yes.
instead of when I went on this program 15 years ago and I was in the doctor's lounge, I had people that were trying to sabotage me.
Yeah.
And I realized it was like that old Rodney Dangerfield movie where he said, if you surround yourself with fat people, then you won't look so fat. And I think that's what they were trying to do. They didn't want me to start losing weight and then them not.
Yes. Yes. So I've found it's been very, very easy, particularly once you get down to the weight that you want. What I've found, where this program really excels above all the others, is that it gives you a very direct and very structured way to then have a maintenance program, so that you don't do this roller coaster of up and down, up and down, up and down. Once you reach your goal weight, you are able to maintain that goal weight, and in a very structured and a very simple way, and still continue to have all the encouragement and all the resources available to help you do that.
Well, I know, Alinda, there's people out there that they've been praying for something to come along. They've been wanting something to come along. They've been looking, and so often, I think you probably see this with people too, is is people are operating in a state of despair. They're looking for something and they want a ray of true hope. And,
Yes.
and I know that when we connect with someone, you or me or somebody who's watching this on someone else's timeline, whoever it is who invited you to listen to this, nobody is going to be hounding you. No one's going to be trying to drag anything out of you other than what you want. What is it that you really want as far as health goals are concerned? And we're asking you to, rather than operate from a platform of despair, which is where so many people are, the person who's sharing this with you, including Dr. Cox and me, we want your success. We know what it's like to feel good. We know what it's like to be able to, in the back of our minds, know that we've cut our cancer risk, among other things, to know that we can be the age we are and not be on medication because of high blood pressure or diabetes or high cholesterol. And so I'm simply saying, reach out to that person and simply say, what do I need to do? And what they're going to do with you is they're going to say, well, let's set up a time, about 10 or 15 minutes on the phone. Let me find out what your health goals are.
Yes.
Let me share with you how our program works and see if it's a fit.
Yes.
And if you don't feel like it's a fit for one reason or another, you know what? At least you've learned something new. And you know that if whatever it is you're doing, you do, we'll always be there for you, because we have a passion to help if you're a physician watching this, same thing. We have a passion to help you help your patients and to help your family and friends instead of just doling out medications.
Yes.
And if you've been wondering, like, is there really something out there? We're telling you that there is.
Yes, definitely.
So, Alinda, I appreciate your input, your knowledge, your gentle demeanor. And
thank you, Joe. This has been fun. It's really a very, very nice way to get information out there. You know, it's ignorance or just not knowing is something that can really hurt us. And there is an initiative to really improve the health course of our country. And so, and with overweightness being one of the primary targets that we're trying to address.
You're right, and there is a lot of misinformation out there. I know. I think it was Mark Twain said, "It's not what people don't know that hurts them; it's what they know that ain't so." And so we're simply saying, if you're looking, challenge what we've said tonight, research it, because I think you'll find that what we're doing is we're bringing, like Dr. Cox said, good information to you, because we want to get this information out, because we want to help people, because that's what we do.
Yes.
Anything else, Alinda, before we close?
No, I think that's great. And certainly, as you said, if anyone has a question, or any questions about the program or anything that says, certainly they can message me. And remember, you know, we're as we said, we're not your physicians. You know, we're just giving information. If you have a physician somewhere and you're having some issue, please see them, please talk to them. But we're just bringing some data to you that just makes you, you know, think a little bit more about this problem we have in this country, and maybe that you have, and how this overweightness or obesity can really affect many areas of your life. And I think we'll be sharing some things even a little bit later in the next few days and few weeks, just some more information about these things that are happening with obesity.
Well, you're right, Alinda. This has been so much fun. We might even start a series. So thanks so much, and good night, everyone. We hope you got some good information and enjoyed this, and we'll see you next time.
Bye-bye.